Sexual and reproductive health is a subject which is not much appreciated for an open discussion in our country. While sexually transmitted infections continue to be one of the major public health concerns. At Medicircle, we are conducting a series on Sexual and Reproductive Health Awareness Day to raise awareness about the issues related to it and to educate the society to reduce the spread of sexually transmitted infections. Hi, this is Sana Khan, and today in this initiative, we are going to speak to Dr. Anil Elhence. Dr. Anil Elhence is a consultant urologist. He has 27 years of experience in this field. He is currently working at Dhanvantri Hospital in Uttar Pradesh. He has specialization in upper tract, lower tract and urology, reconstructive urology, uro-oncology, impotence, and urodynamics. He was the past president of North Zone chapters of Urological Society of India and also a past president of Urological Association of Uttar Pradesh and Uttarakhand. Hello, Dr. Anil. Welcome to Medicircle.
Hi, how are you doing, Sana?
We're fine, sir. So, doctor, to begin with, what should one do to maintain and improve sexual and reproductive health?
Well, there is nothing very specific to have a specific regimen to maintain your sexual health. It is part of being healthy overall. So, to be healthy overall, we need to follow certain basic tenets of life, and that is to maintain a good body weight, appropriate for your sex and age, eat adequate nutritious food, and obviously avoid indulgences. Again, we can't be very saintly and say totally we can avoid all the not so good things in life, but yeah, we should be moderate with our choices in what we eat. And most importantly, we should be exercising very regularly. So that also would play a very important role in being sexually fit. So the key to eating properly, a regular exercise, maintaining your body weight, and of course, in case you are genetically so inclined to where you have had, say, certain diseases like diabetes or hypertension, which you were there in part of your genetic structure, which you inherited from your parents, then probably be extra cautious in maintaining your body weight. And if even then there is diabetes and hypertension or any other chronic ailment, to take adequate treatment, both in terms of therapy as well as dietary restriction for the same. So with this, with a overall good general health, I think the sexual health should be fine.
Okay. Doctor, in India, sexual and reproductive health is considered a bad topic, and mostly the youth is introduced to puberty from other sources and not their parents. Do you think this is the reason people find it difficult to discuss sex-related matters with their parents? How can one eradicate this communication gap?
Of course, I mean, we in India consider sex as a taboo subject, and parents would not talk with their kids, and teachers would not discuss it in school, in their classrooms. And whenever even a slight mention of it is made, say in a classroom, the kids will giggle and smile and give side glances as if something very naughty is being talked about. The basic fact of life is the fact that if you are sitting there and I'm sitting here, unless our parents were sexually active, we won't have been present here. So the entire, all generations of not just human beings, but animals are all there just because their parents indulge in sexual act. So sexual act is as important act as the fact that we eat, we defecate, we pass urine, we move. So it is just one of the body functions, and an important function to get the generations going. So there is nothing taboo about it. And unfortunately, we have not given it the adequate importance that it requires. And it starts not from school, but from home. The parents have to. And why do the parents don't talk about sex? Because they themselves were uninformed. So it's something like the classic example of whether the egg comes first or the hen comes first. So in that sense, the parents have to be educated. When they are educated, they would be more open with their kids at home. And talk to them about the issues that the kids will face in puberty and how would they react with the members of the opposite sex.
Right.
And the kids get that reinforcement of the same information from the schools. So it is both this home environment and the school environment that requires a drastic improvement so that kids are taught the right things. And what happens today, we are all so much on the net and on social media, and all kinds of informations are available. And what happens is sex has become more voyeuristic, and the kids get exposed to sex in as something which is to be like, what word should I use? I mean, something which is to be probably misused,
right,
rather than being part of the of normal body function. So there is a lot of lack of education, and it has to start both from school. If the schools do it, the kids today become parents tomorrow, they teach their kids, so it's a vicious cycle. So both the home environment and the school environment have to be there. And of course, it's very difficult to monitor what is available on the net and what's available on all kinds of social media. So that's a tedious task to do, and I don't think it will be possible. I mean, all governments would be there trying to stop most of these pornographic sites, but then it's a losing battle. It's very difficult to check content there. So what we should be focusing in is at least giving them an adequate education in these places where kids are important. It's very important for them to understand the changes that would occur in their body once they hit puberty and beyond, and to make them understand that getting attracted to the opposite sex is natural. It's part of life. There is nothing bad about it. And once the and a big misnomer is masturbation. So masturbation causes so much ill health, so much because the fact that most kids, who almost everyone will indulge in masturbation, the degrees might vary, but the kids have this focus that what they are doing is something wrong, something bad, and they have this guilt complex, and they correlate it to various diseases which they have, and whether they have it or not, they feel it's because of what they did. So masturbation is a big subject which needs to be told to kids that it's natural, do it, how to do it safely, and do it properly. Following which we come to the next act, which is how to tell them how to go about having sex and how to have safe sex. And so changes at puberty, masturbation, and having safe sex are three areas which require a lot of education. And if we need to go beyond the school education where just the genital systems are taught on a blackboard, and this is what a male system is, what a female system is, so the kids have to be told much beyond that, and have to be told about how to indulge changes that which have obviously being taught in the class, but also the fact that masturbation is something which is pretty okay, and then also how to
it's a normal process that if we educate them on the at the right time, I think that should be very helpful to them in the future.
Yeah, they won't have those guilt complexes. They won't. They won't have those guilt complexes, and they come up with all kinds of symptoms. They have those psychosomatic disorders which they relate to their. It's a very common thing. I'll say it in Hindi. Oh, they'll come with all kinds of complaints. Sir, वो बचपन में गलती हो गई थी. So they always relate to masturbation as गलती हो गई थी. So it's not, and even when a young kid comes and he's got some problems, and I tell him, you need to masturbate regularly to get out of this problem. I mean, it takes a while to make them understand that it's fine, it's healthy, do it. So they find that it's. So even when they get this information from their friends, that the friends would tell them, or the other sources would tell them masturbation is something forbidden fruit kind of thing. But I tell them, do masturbate at least you get to know your body, you whatever the urges are inside your body, you are able to release them, and you at least your social behavior becomes better. You don't indulge in some idiotic act out on the street.
Right, right.
So even that helps the law and order situation also. I think it would help to some extent indirectly.
So I think the main reason is the awareness should be within the parents, that they need to educate the child on time so that they pass it on to the other people in their peer groups and their friends.
Yeah.
Their
So,
right.
so if you have to start, say, from a scratch, both the parents as well as the kids need to be taught, despite the fact that the parents would have indulged in sex.
Right.
Yeah, they would have. And if it is done with them both being present in the same room, at least that hesitation while talking of those things. A classic example, you're seeing a movie, and now the content, especially on the OTT platforms, are such that, I mean, there is the days of those A and U movies are all gone.
Right.
So especially on the OTT platforms, with kind of abuses, and the young kid would ask, what does that abuse mean? Right. So I mean, it's not related actually to sexual health, but so that openness needs to be there between the two generations, so that they can really ask. And of course, if there's nothing to be ashamed of.
An open discussion is very important.
Yeah, like on a movie there, and there's a particular scene coming up, and everyone's become quiet or have started fiddling with their phones, looking sideways. Right. So yeah, so it's a very common thing which occurs, but
right, such a common attitude.
Yeah, you start. I mean, the lady of the house would think, oh, it's about to work, and she'll go out. Okay, I'll get some glass of water, and people walk out or start picking up their phones. So this is because they're all uncomfortable dealing with a normal situation.
Okay, Dr. Anil.
And if the kids know that their parents are going to have sex in the bedroom, what's so wrong about it? Had they not done it, the kid won't have been there. Right. So they need that privacy and that space. So I mean, that openness has to develop. Only then the kids would then have a very natural response to sex. True. Rather than a very forced sex. Wait karenge thoda.
Right. Okay. Doctor, sexually transmitted disease continues to be one of the significant public health issues. While awareness is a possible solution, what other factors do you believe shall help reduce the spread of STDs?
Well, one is inherent of the part of the what I was talking for the last few minutes, was that part of the education does educate about having safe sex. Mm-hmm. And safe sex would be both for prevention of these sexually transmitted diseases, mm-hmm. which could be related to genitalia and even related to the skin. A lot of skin diseases are transmitted due to the intimate contact. Okay. And also preventing unwanted pregnancies. So safe sex would prevent unwanted pregnancies and the resultant complications occurring as a result of abortion or carrying through the pregnancies, both the social and the other issues which occur. And regarding the sexually transmitted disease, there are, to some extent, we are better off, mm-hmm. And to some extent, we are worse off. We are better off because our antibiotics have become very potent. Okay. So the disease of the old, I mean, if a person has had an exposure and he takes these now available very freely, basically off the counter, they can go to a chemist and pick up antibiotics and eat it. So most of these infections can be controlled. But we are seeing a recurrence of now the resistant forms of these very old infections making a comeback because of the widespread misuse of these antibiotics. Right. At the other end, we have these viral infections, which will both have HIV or human papillomavirus, right. Which have not only immediate effects but even long-term effects in having the causing ill health. So one aspect is to know how to indulge in safe sex, mm-hmm. and that would the most important part of is, I think, is wearing condoms. The universal availability of condoms to remove the stigma attached to the marketing of condoms and not to giggle about a condom ad or to think what a condom is. It's so making it like buying a toothbrush or a toothpaste.
Right.
Uh, so condom would help to a very large extent in prevention of these and universal availability. The second aspect, which is again a kind of a social impact, is where I strongly feel that um, a lot of young men, because of lack of opportunities, would end up visiting sex workers.
Right.
And those sex workers are not officially there, but we all know every city and town would have sex workers available.
Right.
So the even the sex workers need to be tutored and made. They should insist upon their clients using the protective measures.
Right.
So even on that, on a social aspect, that would help prevent sexual disorders to a large extent when the sexual workers are taught about the how to prevent and the consequences of having one of the disease both for themselves and transmitting it
Right.
to their clients. So um, and obviously they would many of them might not be in a situation to refuse, but probably if all of them start insisting on using protective devices, then probably the client would not be able to insist or force upon them not to use those protective devices. So both education as well as the vulnerable groups where we know that these diseases are rampant.
Right.
Another group which is very commonly given example is the truck drivers who are driving cross country and are out of their homes for long, um, many days, and then most of their places where they stay overnight, they keep transmitting these diseases. So these groups, which are both the who are either the clients or the service providers in this business, should be so even the truck drivers could probably be one of the groups to be targeted where they are taught about the consequences
Right.
of getting those diseases and how to prevent them.
Mm-hmm. Okay, thank you so much, Dr. Anil, for coming to our show and
Thank
sharing
you.
your valuable time and insights with us. It has been a pleasure having you on the show.
Thank you. Thank you. Welcome. Thank you. Bye
Thank you
bye.
so much. Bye. Have a good day.
Thank you.